Namaste, Dr. M. Krishnan.
Namaste, Dr. Rajkumar.
Do you not think the patients who are reaching us mostly with multi-morbid conditions, they are caring to name their diseases first instead of telling about their physical condition? When they are right in front of us, they will be caring to give away the diagnosis which Western doctors have given them. Your condition is called this. So they have been mentioning about the names of their diseases, and that is deeply sown in their minds that they even forget about the kind of suffering. They forget to mention about what are complaints they are having. So it is like it is. Do you not think it has become so mechanical that this medicine in that disease, like that their minds are getting trained in, and they want some universal remedy for their one disease or perhaps two or three diseases. So that is how things are going. What do you think? How much relevant is what they are mentioning as diagnosis to us, for us being Ayurveda doctors? Do we need to write the same thing in our prescription and start thinking about medications?
Actually, what is happening in today's practice is like that. But everything starting from diagnosis, prognosis, treatment principles, or they don't have treatment principles like that. Their sort of management, everything is different from Western science, what Ayurvedic system is advocating. A system which focuses only on symptom suppression and never on cure of diseases. So there, what all statements are there, what all diagnoses are there, it cannot be considered as ultimate. It cannot be considered as supreme, because in Ayurvedic science, in science-based, evidence-based Ayurveda, we focus on cause mechanisms. So when we are identifying a disease with cause mechanisms, it's when we are able to advocate a treatment method in that cause mechanism, and when we are able to reverse that condition, it cannot be considered as having bad prognosis, or it cannot be considered as whatever their statement is, which is incurable, or these values are to be attained, or such statements are invalid. And starting from acute infections, what they say as incurable, or which they don't have any medicine, is not for Ayurvedic community or Ayurvedic physicians.
They are telling that infections will resolve naturally, spontaneous recovery
you
happens.
just need to wait for 5 days care, or 7 days.
Yeah, supportive care.
Actually, infection is immune response to body's means microbial agents or infective agents. So they don't have a treatment or medicine to modulate the immune mechanism to fight against these microbial agents and destroy that. So when they say that COVID-19 is not treatable, or it's not curable, and or many other new infections which are emerging, they are not curable, and vaccines are only the preventive measure to be taken for this, to prevent this development of these viral infections. All these are invalid according to Ayurvedic science, because we can identify the nature of external cause, nature of immune response, we can modify the immune response, we can facilitate an environment which is hostile to the microbial agents, and it can destroy, and immediately, means whatever they say it has 5 days to get subsided, but immediately immune response happens, and innate immune response happens, and it gets subsided within 2-3 days, or maximum 48 hours it gets subsided in a normal individual without any other. And in chronic diseases also, like allergies, autoimmune conditions, whatever their diagnosis is, psoriasis, if they diagnose it as a condition also, the underlying cause might be different. Sometimes an infection might be triggering that, or infection might be the root cause, which has paved later for an autoimmune condition. Sometimes allergic conditions can escalate. There they are mentioning about some trigger factors like certain drugs, certain infections, or stress can increase psoriasis. But the exact cause mechanism, or with external environment, the relation with external environment, everything could be explained in Ayurvedic science, and our prognostic standards are entirely different from Western systems, and our values are only to confirm what our diagnosis is and how our treatment is responding to that. And also, if the patient has done something wrong, we can identify from that also. And people think that gallbladder stone is a surgical condition. It's not like that. Kidney stones are always surgical.
Right.
Or initial stage of appendicitis even we can manage. Means with SBBA guidelines are applicable. With SBBA guidelines, it is possible to reverse the appendicitis initial stage, or with the conditions which they consider it as surgical. Could be reversed. So chronic conditions, surgical conditions, acute conditions, everything is entirely different from Western system perspective.
I think this is something which the public should really know, because what the Western medicine experts are giving as ultimate final judgment about the clinical condition of the patient entirely refers to the opinion of the Western medicine.
Correct.
So you should not be considering that in your condition surgery is the only option. Of course, there are many conditions where surgery is the only option, but it is not like all the conditions which are finally judged by a Western medicine expert as surgery as final option may not be the one. So there are many conditions, unintended surgical conditions as per the Ayurvedic perspective. I think many conditions surgery is done, and other surgical interventions are done which can be avoided. So but people are believing them like final, what the Western medicine experts are telling, that they are considering as final. I think it's high time.
Within 1 or 2 days, if they are not seeing the gallbladder stone is not getting expelled, or their symptoms are not improving, they immediately go and do surgery. So they don't wait for 5 days.
That's because they are
that much
scared
ingrained in their brain that this is surgical, and you should not
wait for the natural
symptoms
resolution
to escalate. Also, in the case of metabolic diseases
also, it's like
metabolic syndrome like diabetes mellitus or dyslipidemia or hypertension, the people are very much scared. With values, when values come to almost normal level, they think that it is under control. That is a wrong message, because a diabetes and disease develops with some external cause has been habituated, and that external cause can cause change in the internal environment. So that disturbance in internal environment, the nature of internal environment will be reflected in one system which develops as a disease. So the whole cause mechanism are there, and finally they are decreasing the glucose level and saying that it is under control. That is a wrong message to the society. So when we start our treatment, these values can slightly increase. So they think that their disease is getting aggravated. So that is a wrong message, because when we correct metabolism, it automatically body takes some time to adapt to that, and it within a week or within 2 weeks the values become normal. But before that itself they get stressed that their values are going up. It became 140, so they think that they are going to get heart attack immediately, they are going to get stroke. Also this hypertension, when they hear the word itself, blood pressure, so they think that it is so much pressure is inside and heart is going to burst. It's like that. When pressure goes to 140 or 180, they think that it's very high pressure. So, or 150 or 90 millimeters of mercury, they think that it is very high pressure. Pressure means they think of pressure cooker, I think. And if the pressure is not released, it will immediately burst. So such kind of feeling, and they are not ready to understand, because that much so much fear they have ingrained in their brains.
So the main thing is that underlying cause mechanisms responsible for their diabetes, for their hypertension, vary from person to person. So the doctors are not hardly knowing that what exactly in this particular patient, which is the cause of this diabetes. Sometimes
many primary hypertension cases are because of inflammation.
After COVID, many steroid cases, steroid-induced cases, they have developed diabetes.
Diabetes,
And
hypertension.
also after COVID period, people were having they were not doing any kind of activities, that also triggered slow
Yeah.
metabolism. So what exactly has triggered diabetes in a particular patient or hypertension in a particular patient? People do not know that not drinking water, dehydration, anemia, chronic inflammation, all these can cause hypertension. So they are not educated in these matters. And these doctors who are giving them anti-aging drugs, the drugs which suppress the production of cholesterol or suppress the BP values by working on heart, kidney, blood vessels directly, etc., etc. They are not telling the facts. It's very important that the patient should be knowing how their BP is so like controlled. And one
It is not
interesting
controlled, it is suppressed.
suppressed. One interesting fact which I find in my observation is that most of the patients who are on these
antihypertensives.
drugs, these antihypertensive drugs, they are having raised BP. Very high
At
BP
that time,
also
they are not
commonly.
tense. When
But
we
they are-
start our treatment
and it
the
starts
same,
lowering, they
Yeah.
get scared.
they get scared.
When it
whether-
starts lowering, they get scared. That is the most surprising thing I am noticing. When it was 180, 100, while on 3 antihypertensive drugs, they are not scared. They think that they stay protected. And when we make every scientific modification in their diet and regimen and protect them, absolutely protect them, protect their internal environment and stabilize, bringing down BP naturally in a healthy way, they are getting scared. So you can imagine how they are getting slaves
deeply
to
into their minds.
obsessed by these
Even
values.
by scanning, many will be having disc bulge.
Right.
It can be by their nature of job, by their habituation, by their age. There are so many factors. There can be an inflammation behind a disc bulge also.
Yeah.
But finally, they find a disc bulge in L4, L5 or L5S1. Immediately they will be diagnosed as intervertebral disc prolapse, and immediately they have to undergo surgery or traction or so many other treatment measures. And when we start our treatment and when we try to make them understand, they never get understood that these are caused by inflammation or some other thing, and they will be thinking only of surgery or other measures. So that much deep, what do you say?
Fear or panic is induced.
Panic is created in their minds, and I think it's a sort of business.
I don't think it's an ethical way to induce panic in a patient. So panic can be induced for right reasons. If they are not doing exercise, they can get a heart attack. If they are continuously eating junk foods, they can get heart attack. Or if they are drinking alcohol or any sort of addictions continuously, they can be.
They are obsessed with thyroid values.
Yeah.
Even though thyroid values T3, T4, free T4, everything is normal, they are obsessed with TSH value.
Correct.
TSH value is increased also, or increased or decreased if thyroid hormone values are normal and all the clinical features have disappeared. Then also they are fearing that TSH value is little bit high and I am suffering from thyroid, and whether I should take thyroid hormone or not. If they take thyroid hormone, their levels will be normal. So you are taking a hormone and your values are normal. What is there? Is it a treatment? So if you stop those medicines, its values will be changing. But when we treat and when SBBA treatment principles are applied and when they are brought to T3, T4, free T4 levels normal, and slight increase in TSH, they get feared, they get scared whether it will cause some other complication or not. So this is a
very detrimental situation that actually
so it's people's lives. So they should be open-minded, they should be honest, and they should not be misled that when your BP is suppressed, you are never going to get any other complication. When your diabetes or hyperglycemia is suppressed, you are not going to get any complications. They are just delaying the complications only, that the patients are not knowing. So when we improve the metabolism and when their glucose level comes down, they think that still they are having that fear that they may get complication because they have stopped those medicines which their physician has asked them to take for lifelong.
So it is like falling as slaves to one suppression mode of approach of treatment. So what is being done by every system of medicine, the patients are supposed to know. And this applies to diagnosis also. Like in Ayurveda, unlike modern medicine, the diagnosis is done for the patient and not for the disease. So when patient comes with a name of a disease, diagnosed as this disease, it doesn't mean anything to us. It doesn't mean, honestly speaking, it doesn't mean anything to us. We will have to probe into Ayurvedic diagnosis of the patient.
Yeah.
Then only we can really help you to come out of the multimorbid condition. We are diagnosing patient and not only one diabetes, hypothyroid, etc. We are seeing the patient. Our science recommend us strictly. There are certain tools, means and parameters for us to appraise the patient.
Yesterday also one patient came that he was having cough and rheumatoid arthritic patient, non-case of diabetes, non-case of hypertension, and he is asking to just address the cough problem which he is having for last 1 month, which is not responding to antibiotics, and the doctor has already told him that it is allergic, and he wants treatment for allergic cough from me, and no need to mind this rheumatoid arthritis, diabetes and hypertension. So actually I tried to convince him, and he has taken prescription also, but what SBEBA or science-based evidence-based Ayurvedic approach is, the patient as a whole is considered as the object of treatment, and objective is to make him heal or make him healthy, or take medicines, withdraw drugs and all treatment after making him healthy. That is the objective of Tadeva Yuktam Bhaishajyam Yad Arogyaya Kalpade. So the objective of treatment is to reverse the pathology and to make healthy. The same hypertension cause might be different, but so the diagnosis is just for namesake, for communication we can use that term hypertension, but the cause behind is more important. Like disc bulge can be by inflammation, so we are not giving treatment for disc bulge. In Ayurvedic hospitals also he will be given so much Panchakarma treatment or Snehasveda, Pirichil, Kiri, etc. So what Western system says, or what Western system diagnosis is, what Western system prognosis is their own limitation, and it's not related to any other system. So it is incurable, means it is incurable in their system, that's all. So these might be the challenges when patients come for Ayurvedic treatment. What do you think?
Yeah, these are the main challenges. So what I do is, we have to be, as being your SBB practitioners, our first step is educate before medicate. So first of all, what I do is I enable my patients to understand the real situation, what is going on in their body, and how the present treatments. Being an expert in clinical pharmacology of Ayurveda, I'm attaining, by the grace of God, I'm attaining that adequate confidence to understand and explain regarding the mode of action of the treatments, what is rendered in Western medicine. So I am able to explain and educate them regarding what the present treatment is currently doing in his body, and what my plan is to do in his body. So when I explain both the sides, I leave the entire things to the patient to make a decision. I'm not inviting him, come here, I'm having universal remedy for this. It is the ultimately, as rightly told by our science, wisdom is essential for the patient to make a wise decision about his body.
Yeah.
So we are making him educated about all the pros and cons of all these existing things, and what our intentions are, honestly.
How the values would be.
What they can expect. And people are very much obsessed by values. So when I am stopping this BP drug, tomorrow when my BP will be raised, So will I get stroke? Will I get heart attack? Will I not get? It's not like will I get. Patients are that much made. I think they are put into darkness of fear and so much of fear. They are asking back, when I'm stopping this drug tomorrow, when my BP shoots up and I get stroke, what will I do?
And they will be stressed also. Every time when they check,
yeah,
it will be slightly raised
yeah,
also.
every time they are remaining in stress means that can happen. So it's a big challenge. I am telling them I am doing everything from inside to make sure that you stay protected. It's not like blocking, masking, suppressing what I'm doing.
We are taking the responsibility.
Yeah, so taking responsibility I'm doing, and I'm doing it also. I'm not merely telling. So we know that those patients who are really in risk, they are kept monitoring. They are kept here for monitoring for 3 to 5 days till the protocol gets fixed. So this is one challenge which I am facing. And second challenge, they will be going. Other conventional Ayurveda doctors are asking them to come back after 1 month or 3 weeks. Same medication has to be continued. But in SBBA, our intention, as you told right, is to take the patient out of medication and necessity of medication by completing the phases of treatment. So first phase is to reverse the acute phase, and second phase is to stabilize. So we cannot keep a patient in our arrest for beyond a month generally, except in very rare cases where maybe 1 or 2 months excess. But beyond that, but this
in those cases also there will be a slight cause which they might have practiced, or slight deviation, some erratic practice.
So
they might have done.
Minor mistake, it is important for us to identify, and for this reason we ask the patient to come back in 7 days. Then they tell doctor, I'm in Bangalore, I'm in Delhi, I'm in Calcutta, and we don't do online consultation. As online consultation, as we know, it's not possible except in first aid we are doing in infective fevers.
Yes.
So this is one big challenge. So what is to be known for the patients is that when patients are approaching for SBBA treatment, they should be knowing that this is only for 1 or 2 months maximum, but they have to do it phase by phase. 2 phases are there mostly. So it is important that everything has to be followed.
Actually, this
accurately.
is done in a natural way. And also we are addressing cause mechanisms. When we are trying to reverse a disease condition, changes happen every hour.
Yeah.
So every 2-3 days or after 5 days we need to meet, because it's not for lifelong medicine we are giving.
Yeah.
We are making a change inside the body. When changes are happening, the stage changes. Stage of the disease, stage of the patient, status of the patient changes. So in that status, what to be done is again to be reviewed, and we have to decide. So we will be asking patients to come after 5 days or 7 days. So every 5 days, every 7 days till recovery, the patient has to meet us. So it cannot be done online. We will be missing so many things, and the patient will not be revealing everything also. And we spend a lot of time to
understand
their mistakes, as well as whether we are going in right direction or some other factors are there also.
It's like solving a mathematical problem, but more than a problem, it's a human being. So we cannot make mistakes.
It's an exhaustive process.
Yeah, so it is a very big challenge, but we do enjoy that challenges, because finally we know the ultimate results. We can see the smile.
They are naturally becoming healthy.
We can see that smile glow.
From all their diseases, they are getting relieved, and they are moving towards health.
Yeah.
There are no complications. When they are moving towards health, there is no complication.
Right.
And also, many have asked, like, why modern tools like lab investigations and scans are used by Ayurvedic physicians.
Yeah.
In olden times,
They were not there.
Yeah, these tools were not there.
Yeah.
Why Ayurvedic people are?
So Ayurveda, basically 4 kinds of methods are explained in the science of Ayurveda, among which one is observation, pratyaksha jnana. So we are meant to observe certain things. Examination of the patient comes in that, under that. So whatever tools with our eyes also we can inspect, with stethoscope we can perceive, we can hear the cardiac sounds or lung sounds, whatever it is, we will be able to directly perceive these things with the help of diagnostic aids. In ultrasound, we can understand the structural things. So everything comes under Pratyaksha Jnana only. So it is not any modern investigation or tool. And of course, lab parameters, all these biochemical values are indicating different aspects of immune function, metabolic status, all these things we are able to assess from the blood test. So it is very like, it will accentuate the accuracy, precision in what we are knowing and doing. Definitely it will enhance the confidence of SBBA practitioner, and we can also moreover display the evidence of results like infection status before and in 3 days how much like acute reactive proteins like C-reactive protein, etc. We have seen during COVID times, and in Hastalamba what the doctors are doing, our trained doctors, we can show the results. So people think that Ayurveda is slow and sluggish like a snail, but we can show that better than antibiotics, this infection is getting reversed in 3 days. So that we can show materialistic evidences before them, even gallbladder stones and calculus, then fibroid, cyst, all these we can show the physical evidences by these diagnostic aids.
In SBEBA, the perspective is different because we know the modern things, how it can be incorporated in Ayurvedic science. Ayurvedic science is a very vast science which can contain all this information also. So all the structural elements with their functioning are explained in Ayurvedic science, and the present day lifestyle as well as modern medication, Western system medications also have changed the nature of diseases. New diseases have emerged, and their method of identifying those conditions and their cause mechanisms are all deciphered in science-based, evidence-based Ayurveda. So with that method, we can identify as well as we can treat. We can treat with specific treatment principles, and we can find out how far the patient is improving, and we can show the public also, or we can show with results also. And if the patient goes wrong also, we can identify with
very
lab,
important.
Lab parameters.
Yeah.
So in SBEBA, we are utilizing the lab investigations and scanning methods with Ayurvedic. From Ayurvedic perspective, we are understanding and
we are utilizing the results. We are understanding and applying the results in Ayurvedic perspective. It's not like in Western medicine, doctors are asking to do diabetes, blood sugar and cholesterol only. But we are not, for us,
without giving any anti-hyperglycemic or anti-hypertensive medicine, we can address the cause mechanism and reverse the disease and show the result.
Yeah.
Like glucose level coming to normal, or HbA1c, as well as this blood pressure values.
Yeah. What I mean to say is that they are not caring to check for the immune function. Modern medicine, they are looking for this diabetes and thyroid and cholesterol. But for us, we know that we are looking to understand the immune status from the blood counts and all. So we know how much impact they are for our treatment, for enhancing the accuracy of our diagnosis and treatment.
And once the patient comes out of the disease, they will be more confident, and they will be knowing, they will be developing a self-realization and discipline.
Yeah.
So further, they are discovering themselves. So it's a process like spiritual journey. They will be discovering self, and they will be living a disciplined life because they know what all are unwholesome, what all are wholesome for them, and how they need to lead their life in case of development of any acute conditions, what all things are to be performed
like
to reverse it.
Infection comes, what to do. We are giving non-medicational first aid knowledge, education. So they will reverse their infection in 2-3 days, while others at home may take several days. So we can make the healing process faster by knowing this scientific crucial knowledge. It's not like what you find as Ayurveda outside. What is explained in SBBA is entirely different and entirely specific.
So that's
precise.
Also a challenge when patients come. Just like public awareness class, we have to take class for each and every patient.
Yeah, they are getting anti-knowledge about Ayurveda through YouTube and internet sources. So it's very difficult for us to. So that is also, anyway.
Yeah.
So
So
thank you
we'll
very much
wind up.
for your time. And it was a necessity for public to know the exact things like
Scientific
when you
Ayurvedic approach
perspective.
in modern day diseases.
Yeah, so no need to worry about the names of the diseases. In our science, it is mentioned as such. What is more important is to reverse your disease and attain health as
Diagnosis,
early.
prognosis, and treatment mentioned by Western medical system is entirely
Entirely
different from Ayurvedic system. That's
That's-
what we wanted to convey.
Thank you. Namaste.